स्टार्ट करते हैं. Okay. So today we'll discuss about glanders. Glanders is a very disease which is mostly prevalent at the time of World War, mainly in the World War II, in the various part of the world, mainly in the USSR or UK. So this is the disease which is mainly infect the solipid animals, and in which it affects the family, the members of the equidae family, mainly horse, mules, and donkey. However, it can also transmit or infect the other animals, like in some felines or camels, and same time it is very infective or contagious to the human being. So through the contact with the infected materials, like the discharge, nasal discharge, or skin lesion, infected in skin lesion, the human can get the infection by the direct contact, or you can say the entry of the organism through the mucous membrane of the eyes or mouth, or the direct contact of the infectious agent with the any cut or abrasion which is present in the human being. So anyhow, in the handling or in contact with the infected animals, human can also get the infection, and it is very infectious or contagious in human cases. So the organism of this disease, that is Burkholderia malaria, is also means threatened to be used as a bioterrorism agent. So this is a very important disease. However, nowadays in various countries, the disease has been eliminated through the various strict quarantine practice, or through the movement control. So this is a contagious bacterial disease which mainly affect the equine or equidae, mainly horse, mules, and donkey, and it is caused by the Burkholderia malaria. Malaria, malus is actually means the malignant, because in later we'll see in later slides, it causes the nodule formation, or nodules formation, just like in the tumor, or that generally refers as a nodule, or glands, just like in gland. So this is sometimes that glanders means also the nodules or glands. So similarly, in malleus means the malignant disease, and because it forms the nodule, so ultimately it forms the nodules, or that becomes ulcerated, and which causes the discharge or formation of the some lesions on the skin or the mucous membrane of the upper respiratory tract, or in the lungs. So that's why it is known as the glanders, or the organism, the species is also the Malii, Burkholderia malii. So previously that organism is known as the Pseudomonas malii. So nowadays that Burkholderia malii is the new name. Previously it is the Pseudomonas malii. As the Pseudomonas is the gram-negative organism, and this is the only species of the Pseudomonas which is the non-motile. Other Pseudomonas species are motile in nature. So this is non-motile, non-encapsulated, non-spore-forming bacillus, and this is related with the evolutionary related with the agent of the maliodosis that is caused by the Burkholderia pseudomalaria. Means anyhow it is antigenetically related with the Burkholderia pseudomalaria that is caused the rodent glanders in the rodent. So this is the agent related with the agent of maliodosis. Then it is highly susceptible with the various physical agents, or just like heating at the 55 degrees Celsius for 10 minutes, or direct in the sunlight for the 24 hours. Or it also susceptible to the common disinfectant. Susceptible to the common disinfectant like iodine, mercury chloride, sodium hypochlorite, but it is less susceptible to the phenolic disinfectants. And also in the environment, if it come into the environment, it can survive for the weeks or month, and in water also it can survive for the months. So this is very contagious once it is come into the environment, if it is left untreated with the any of the disinfectant. Okay, so here already I discussed this disease is presently prevalent at the time of the World War II, but in post World War One era, that disease remain or in means present in the USSR. But in the time of the Second World War, it spread not only in the eastern part of the USSR, but in the central part of the Europe, like the Germany and United Kingdom. Because of the war, they used to move their animals or the soldiers. So in that case, the disease is prevalent in the various part of the Europe, in the America. So that time, the disease was prevalent in the America, US, in the South East Asian countries like India or China. And now still it is a endemic disease in the Chinese horses, and still the disease is present in the Mongolian horses. So in Asian countries, you can say the disease morbidity is high. However, the mortality is comparatively less as compared to other part of the world. So the disease nowadays, as I told you, eradicated from the various part like America, Australia, and European countries, including USSR. And last case from India, was reported in 1991. Similarly, in 1945, last case was reported from America, and somewhat in 1928 from USSR. So, however, some small cases were reported due to the laboratory exposure, because it is contained in the laboratory for some certain region. It is you can say preserved in the laboratory, but in America, I think sometime some cases were reported due to the accidental exposure in the laboratory. So this is about how history, you can say, about the glanders. When you see the human cases of glanders, the first case were reported in the Dr. Sandville, who was the principal in the London Veterinary College in 1723. So first case was glander was Mr. Dr. Sandville. And when you talk about India, the Dr. S.H. Gazer, who was the veterinary pathologist in the Punjab Veterinary College, Lahore. So that time he was contacted the disease during the autopsy of an infected horses. So these are some known cases, or you can say the veterinarians, or this was the first case from the London, and this was the known or first case, you can say, in the India by in of the Dr. S.H. Gager. So these are some known cases of the human and glanders. Host range, you can see, already discussed, it affects mainly the equity, and sometimes the some varieties like dogs, cats, or sometimes camels are also infected. Mainly carnivores infected get the infection by the eating of the infected material or meat of the infected animals. So here you see in donkey or mule considered as the most susceptible animal. So they shows normally the acute form of the disease, whereas in case of horses, they are somewhat resistant. So the you can say the course of the disease is in chronic form, is normally the because of their resistance. So the organism took long time to develop any symptoms. So in donkey and mules, the acute form of the disease, course of the disease is present, and in horses, you'll see the mainly observe the chronic form of the disease. And mainly the human who are the veterinarians or butchers or the groom, laboratory workers or horse handlers are mainly risk group, you can say, or occupational group which are mainly susceptible for the infection. So these are the host range for the glanders. How the disease or bacteria can transmit from animals to human. First is most important with the contact with the tissues or the body fluid of the infected animals, and how bacteria enters either through the any cut or abrasions on the skin, or through the mucous surface of the eyes or nose that bacteria can enter, and sometimes through the aerosol route, or the dust which is contaminated with infected animals, it can transmit them. However, there is a no human-to-human case was recorded till date. And in animals, disease can transmit through the direct horse, means you can say the direct contact, or you can see in horses or in animals. The main mode is the ingestion of the contaminated feed, which is either contaminated with the infected material or discharge. So main mode in case of animal is the ingestion. Others are inhalation route. So these are the main route, or sources for the human as well as in the animals. Now see the sign and symptoms of the disease. So in animals, mainly the disease is present in the acute or chronic form. As I told you, in acute form, donkey or asses or mules mainly shows the acute form of the disease. In acute form, you will see the high fever, depression, diarrhea, or ultimately rapid weight loss or labored breathing you'll observe, and it causes the death of the animals. So in acute form, the disease course is very less, and ultimately due to the bacteremia or septicemia, the animal may die. And the chronic form, uh, again, which is mainly observed in the horses of the endemic area, that uh, that is categorized in the three form. The chronic form is categorized in the three form. First one is the nasal form, or you can say the upper respiratory tract form. Second one is the pulmonary form, which affect the lower respiratory tract infection or the lungs. And third one is the cutaneous form. It observed through the direct contact with the infected horses or contamination of the wound. So these are the three form, which is under the chronic form of the disease. So first we'll see the nasal form, nasal glanders. So it will lead to the ulceration of the mucosa. After, you'll see in, upper respiratory tract includes the nostrils or the trachea or lung. So it causes the ulceration of the mucosa. That ulcer is very peculiar. That is the grayish in the center and the star shaped, or the borders will be the zigzag. So that is known as the jag borders, or it will appear like a star shape. So this ulcer is very peculiar. Later on, through the nose or sometimes through the eyes, you will observe the viscous yellowish green mucopurulent discharge, because after the ulcer formation, it becomes the suppurative or purulent. So in purulent form, it will show the yellowish green color discharge. And you will also observe single time the regional lymph node, like submaxillary lymph node may be enlarged, and later on it also becomes suppurative, and it affects or adhere with the deeper tissues. So here you see in the pictures there is a nasal discharge. You'll observe some grayish color, and it form the crest around the discharge. So crest type means some solid particle around the opening or discharge you'll observe. And here you see, when you see the nasal conchae of an infected animal, you will see the some nodule formation during the autopsy. So these are some pictures which showing the nasal form or nasal glanders. Second is the pulmonary form or pulmonary glanders. Here it will lead to the infection of the lungs or lobular pneumonia or bronchial pneumonia. So ultimately it will show the sign of pneumonia, and it will lead to it will show the first symptoms like intermittent fever, dyspnea, uh, uh, paroxysmal coughing, persistent coughing, or you can say labored breathing. It will show. Then later on, it will show the diarrhea and polyuria. Ultimately, the condition will be means deteriorate the infected animal, and we will also observe the miliary granulomatous nodule formation in the lungs, and later that may become calcified, and ultimately you can see it becomes solidified, just like in tuberculosis. It will first it calcified, and later on you'll see surrounded by the grayish granulated white fibers, fibrosed, become fibrosed later on. And you'll also observe such type of lesion in other visceral organ like liver, spleen, and kidney. So this is the pulmonary form, which mainly affect the lungs by the formation of the nodules in the lungs, and ultimately it will lead to pneumonia, bronchial pneumonia, lobular pneumonia type of the symptoms. Here, third form of the chronic glandular is the cutaneous form, cutaneous glanders. This is very commonly known as the Farsi. The cutaneous form of the glandular is known as Farsi. So here you see it causes the symptoms begin with the fever, coughing, or enlargement of the lymph nodes, and leads to the dyspnea. And actually, the organism is having affinity towards the mucous membrane of the lungs. You can say or upper respiratory tract. So anyhow, you'll observe the such type of symptom. If it is in cutaneous form, you will observe some cutaneous lesion, but such type of symptoms you'll observe because organism ultimately localized in the lungs or the respiratory tract. So later on, you'll observe the nodule formation, which may be which is having the gray center or thick. It secrete the oily or oily liquid, and which cause the which encrustation around the hairs, thick or you can say dry encrustation around the hairs. And here in the just showing in the picture, you will see there is a nodule formation, and this nodule formation is along with the lymphatics, means along with the lymphatic discharge of the lymphatic system. We'll observe the the nodules, and the most preferred site for the nodule formation is the legs, ribs, or in some belly, the part of the belly. So you just see here nodules are present in the legs and some region of the belly. So it will lead to the thickened lymphatic vessels. That because of the nodule formation, it becomes thickened. The vessels become thickened or tortoise, means engorged type. So later on, when the nodules rupture, it excrete the purulent discharge and organisms also. So this is about the cutaneous form of the glandular. Next, you see the disease in human. And here also you can categorize the disease in acute or chronic form. Here, but this is not exact that characterization, just like in animals. But you will observe some acute type of septicemic symptom like fever, malaise, fatigue, jaundice, nausea, pain in the legs, or in some part you will also observe this nodule formation, which is erysipelas swelling, which may be on the face or maybe on the legs, and it becomes painful. And because of the inflammation and the soft tissue inflammation, it becomes painful. And Here you see nodular formation or pustular eruption on the skin, face, leg, or various part of the body. Ultimately, means the main characteristic symptom of this disease is the formation of the nodule. So in human also, you'll observe the nodule formation in the various parts of the body. And nasal, you'll also observe the nasal mucosa which has become congested or swollen, and it will show some sign of the pneumonia or muscular abscess, diarrhea, emaciation. And this type of symptom in chronic cases we will observe for the longer period of time, but the symptoms frequency will be less. But such type of the symptom we will observe, and these symptoms will last to the several days to month. So there is no exact distinguished characteristic of this acute or chronic form in case of human as compared to animals. So now come to the diagnosis, how we can diagnose the disease. The first most important is always the cardinal sign or clear sign of the sign and symptoms of the disease. So here also you can observe the disease by the sign and symptoms. And second one, you can go for the isolation of the pathogen. Isolation, you can take the samples from either from the discharge or from the pus samples of the lung. And there are various media there which may contain glycerol that favors the growth of the organism. But this organism is highly infectious. It can transmit through the aerosol route. So for the isolation, we'll require the basic the biosecurity measures. So this requires a basal, at least basal 3 laboratory or 4. It's better for the isolation. So it's not possible in the normal laboratory to isolate the organism. Then you can go for the Malin test, as this is an intradermal test, and we can use the in whole culture, either whole culture. We can go for the autoclave of the whole culture, and we can inject 0.2 ml the Malin in the intradermal root of the lower eyelid. After 24 to 36 hours, we will observe the swelling or inflammation. Like swelling means edema of the lower eyelid. It will inflammation means we'll observe the acute conjunctivitis and photophobia or some mucus discharge from the eye. If it is present, then the animal is suffering from Burkholderia malaria infection. So this is a very important name test. The similar test, same test is you can use in human also. So there is a serological test are also there. That is the indirect hemoglobination test or complement fixation test, which is most effective test. It shows the 85 to 95% of the accuracy. And dot ELISA is also there. Then you can go for the identification by the dot ELISA method. So these are the some diagnostics test or by the various method. You can go for the diagnosis. And another important test is the Strauss test, in which uh, we can infect the suspected or clinical material to the guinea pig intraperitoneally. And after some time, you'll observe, not some time, in some day, you'll observe the painful swelling in the scrotal sac of the guinea pig, and it becomes enlarged. The sac become enlarged, and it become detached in 7 to 10 days from the skin. That becomes a caseous mass, and it may be detached in 7 to 10 days. So this is a Strauss test, but it is not that much specific, because it can be confused, or this is not that much specific, you can say. So after you are doing the Strauss test, we have to go for the isolation of the organism for the confirmation. So Strauss test is or Malin test is used for the diagnosis of the Burkholderia malaria, and Strauss test is the animal inoculation test, and Malin test is the intradermal test. Similarly, in human also, you can go for the history or contact with the suspected animal or any material, and isolation of the organism from the discharge nodules, and you can go for the CFT agglutination test or Malin test also. So these are the some diagnostic tests. Here you'll see differential diagnosis, because the symptoms you observe is almost means that peculiar in the form of that ulcer formation or nodule formation. But here you see we have to uh, you can say we have to differentially diagnose this disease from the various transboundary diseases of the animals. So we have to mainly differentially diagnose this disease from the strangles, ulcerative lymphangitis, horsepox, tuberculosis because forms the nodules, sporotrichosis because it affects the nasal mucosa, and botromycosis is also another mycotic disease which affects the mucous membrane of the nose and mouth. So there are various diseases from which we have to differentially diagnose the glanders. Yes, how you can control. There is no licensed vaccine is there. Where some live attenuated vaccines are used for the local use, but not in animals actually, because according to the Glanders and Farsi Act 1899, we have to slaughter the animal. We have to kill the animal, euthanize the animal if the animal is found infected with the disease. So ultimately, there is no long-term vaccines are available for the any species of the animal. Then for how we can then second one is the identification and elimination of the foci of infection. Ultimately, we have to eliminate the source. And what we can do is that we can go for the surveillance and monitoring of the infected herd. Means regular surveillance and monitoring is very, very important. We have to go for the proper carcass disposal either by the incineration or the deep burial method. Then quarantine the newly introduced animal, we have to quarantine, especially from the endemic area. Of education of the public and disease notification to the higher authority is also very important, because whenever you inform the higher authority, they will activate and they will take some preventive measures to further spread of the disease. So disease notification is also very important. In human also, the main source is the animals or infected material or discharge of the animals. So care should be taken during the handling or treatment of feeding, dressing, grooming of the animals. So disease notification, public education, these are also common measures you can take for the control or prevention of the disease. Treatment in animals means there is a no treatment is advocated in case of animals, but in humans you can go for the various drug like streptomycin, chloramphenicol, tetracycline, or it may be treated with autogenous vaccines. Means if the person is suffering from the disease, you can take the infected material, suspected infected material, or isolate the organism, and that organism you just attenuate that organism and introduce in same person's body. That is the autogenous vaccine. So you can go for the autogenous vaccine or malign like product. So a malign product is just like we have to separate the organism, or in malign test what we had done, that is we use the autoclaved organism. So similarly, you can use for the such product for the immunization in the infected person. So these are the some treatment strategy you can follow for the. Sorry, this is for the human, no, not animal. So these are this is all about the glanders.